Welcome back to Drug Talk, everybody. In today's video, I want to quickly go over 3 things that you should be aware of before using Altace or Ramipril. Number 1, when you start using Altace, there's a chance that you could develop a cough. In terms of percentages, 8 to 12% of patients who use Altace experience this. It's important to note that the cough is not dangerous and should not be a health concern for you unless you have another chronic condition in which this causes the cough to worsen. Occasionally, the cough will go away over time, but sometimes the cough sticks around and patients may have to switch to a different medication, often in a different class. Altace is in the class of medications known as the ACE inhibitors, and when a patient is switched due to cough, they're often prescribed something known as an ARB. An ACE inhibitor-induced cough may happen after the first dose, or it could happen weeks to months later. The cough that is produced is often described as dry, tickly, and bothersome. This is the most common side effect of Altace. Number 2, when you start using Altace, you may experience hypotension or low blood pressure. Low blood pressure seems to occur in about 11% of patients using Altace. Often, patients may experience something known as orthostatic hypotension or postural hypotension. This is when a patient has a drop in blood pressure when quickly going from a seated position to a standing position. Symptoms such as dizziness or lightheadedness may happen to patients when they take this action. Patients should always receive counseling about postural hypertension upon initiation of therapy with Altace. And number 3, a small percentage of patients who use Altace may experience dizziness. 2 to 4% of patients who use Altace may experience dizziness. Due to the side effect, it's important to know how you react to the medication before you do things like drive or use heavy machinery or other things that may be dangerous if you are dizzy or not alert. If the effect of the dizziness is mild, this could go away after a couple days or weeks. If, however, the effect of the dizziness is severe, it's important to talk to your doctor or pharmacist to make a plan. You may need to adjust your dose or switch to a new medication. And that's all we're going to talk about today with Altace or Ramipril. But before you take off, I wanted to quickly let you know that if you're interested, you can pick up a copy of my new book, The 5th Episode, Inside the Manic Mind, by clicking on a link in the description of this video. Take care.